What does ICD-10 say about diagnosing OCD? Imagine trying to understand what makes someone say they have obsessive-compulsive disorder. The ICD-10, which is a global standard for classifying diseases, has clear rules for diagnosing OCD. It says that for a doctor to diagnose OCD, certain key things must be true. First, the person must experience obsessional thoughts or compulsive acts most days for at least 2 weeks. These thoughts or behaviors should cause them distress or interfere with their daily life. So it's not just a passing worry or a one-time habit. It has to be persistent and problematic. The obsessional thoughts are recognized by the person as their own, not something imposed from outside. For example, someone might have repeated worries about germs or safety, but they see these thoughts as their own. They also try to resist these thoughts or actions but usually cannot. Even if they manage to stop some compulsions temporarily, they still feel driven to do others. Importantly, the compulsive acts are not experienced as pleasurable. Relief from anxiety after performing a ritual is not the same as feeling happy or satisfied. It's more about reducing distress temporarily. The thoughts, images, or impulses are unpleasant and repetitive, which makes them very distressing. The ICD-10 also divides OCD into different types based on what dominates the symptoms. Some people mainly have obsessive thoughts, like constant worries or ruminations. Others mainly perform compulsive rituals, like cleaning or checking. Some have a mix of both. There are also categories for other obsessive-compulsive disorders, or when the symptoms don't fit neatly into one group. Another important point is that obsessional ruminations, like persistent negative thoughts, should not be confused with depression. The ICD-10 emphasizes that OCD can only be diagnosed if these thoughts happen independently of a depressive disorder. So, if someone has both depression and obsessive thoughts, the doctor needs to determine if the obsessions are separate or part of the depression. In summary, the ICD-10 focuses on how long the symptoms last, how much they bother the person, and whether the individual recognizes these thoughts and actions as their own but feels unable to control them. It helps clinicians differentiate OCD from other mental health conditions and guides treatment planning. Remember, if you or someone you know is experiencing these symptoms, it's important to seek professional help for an accurate diagnosis and appropriate care.